Good morning everyone. Today we are going to discuss about the topic temporary anchorage devices, commonly known as TADs. Temporary anchorage devices are small screw-like implants that are used to provide temporary skeletal anchorage for tooth movement. They serve as fixed points against which forces can be applied in order to minimize unwanted tooth movement. Next one is the definition of a temporary anchorage device. A temporary anchorage device is a biocompatible device usually made up of titanium or a titanium alloy that is temporarily fixed onto the bone in order to provide anchorage for orthodontic tooth movement and is removed only after treatment. Next one is the classification of TADs. First one is based on location. It can be transosteal, subperiosteal or endosteal. Second one is based on duration of usage. It can be long term or short term. Third one is based on location. It can be intraalveolar or extraalveolar. Next one, we are going to discuss about the components of a temporary anchorage device. Since it is an implant, it consists of three parts: a head, neck and a body. Next one, we are going to discuss about the insertion sites for the temporary anchorage device. In maxilla, it can be placed between the second premolar and the first molar or the infrazygomatic crust, or it can be also placed on the palatal midline. In mandible, it can be placed between the first and second molars or the buccal shelf area. Next one, we are going to discuss about the indications of a temporary anchorage device. It can be used for anterior teeth retraction, space closure, correction of open bite or deep bite cases, anchorage reinforcement, uprighting of tilted molars, discalization of molars, etc. Then contraindications of TAD include active periodontal diseases, poor oral hygiene, systemic conditions like uncontrolled diabetes, smoking habits, insufficient bone quality, etc. Advantages of a temporary anchorage device includes it is minimally invasive, it provides excellent anchorage control, it provides shorter treatment time, and it is easily removed after use. Next one is the disadvantages of a temporary anchorage device. It includes it can cause infection or inflammation around the implant, root injury during its placement, soft tissue irritation, etc. That's all for today's topic. Hope you all understood. Thank you.